The LGBTQ, lesbian, gay, bisexual, transgender, and queer community is an underprivileged group. They are connected by a common set of challenges in accessing health services. Despite increasing social acceptance, there is a long history of anti-LGBTQ bias in healthcare. As recently as 1973, homosexuality was listed as a disorder in medical texts, and transgender identity still is. Attitudes have improved, but there is still a long way to go. Right now, individuals in the LGBTQ community are significantly more likely to report unmet health needs due to inadequate healthcare providers. Reports of physical and verbal abuse, refusal to touch patients, and a general lack of knowledge have all been recorded by patients. Healthcare providers can better serve their patients if they know more about the risks associated with the community. For instance, the incidence of domestic violence among gay men is nearly double that in the heterosexual population. Compared to heterosexual women, lesbian, bisexual, and queer women are more likely to be overweight or obese. Studies have also shown that members of the LGBTQ community have an increased rate of smoking, alcoholism, depression, and suicidal ideation, in addition to issues related to sexual health. The goal is to give healthcare providers the tools needed to better educate and communicate with their LGBTQ patients. All staff, including receptionists, medical assistants, nurses, and physicians, can be trained to deal respectfully with LGBTQ patients. This information could also be available to patients along with friends and family who want to take an active role in their wellness. By capitalizing on the industry's already advancing resources, an app could be created to outline LGBTQ risk factors that providers need to know and terms they should be familiar with to better interact with their patients. By combining old techniques with new technology, an interactive workshop could be created using video, presentation slides, and take-home information to create a cohesive, standardized education for healthcare professionals in any hospital or clinical setting. A website combining provider and patient information could be created to display general information and common blind spots of providers to allow patients easy access to information related to their care. A poster summary of risk factors could also be made to hang in examination rooms and at resource centers for LGBTQ people to easily and quickly familiarize themselves with their health. Lastly, a more in-depth discussion of community health factors and terms could also be outlined through printed materials for those without internet access. Thank you.